In this next video clip for examination basics, we're going to look at the direction of hip joint extension. So again, first stop is we'll have the patient walk and we'll see if it looks like she's able to extend her hip fully on both sides. When you see pelvic circumduction, you can be pretty sure that the patient has limited hip joint extension. So through visual analysis alone, we can tell that hip joint extension is limited, in this case, on the left side. We'll continue the examination process now by having the patient come to the edge of an examination table. We put a pillow here to support the abdomen and lumbar spine. And we'll have the patient go into sort of a tiptoe position. And now we're going to ask for active hip extension again. You try to make that movement on your own now. So we observe active extension, and we'll compare this bilaterally. Next, we'll determine if pain is limiting the hip extension. So we'll deliver an overpressure test. So Amanda, you straighten your knee, okay, and lift as high as you can. And I'll move in from the medial distal thigh and deliver an overpressure. If this is painful, that might be one of the reasons why we saw limited hip extension during ambulation. Now I'll return the hip back down to the start position and I'll study the end field. So I'll apply repetitive passive motion until I come to the first and final stop and determine whether or not there's an early firm end feel indicating shortening of the anterior capsule of the hip. Our last stop in terms of examination basics for hip joint extension is to see if extension was limited due to muscular weakness. So Amanda, I'm going to have you bend your knee now, and you try to lift that thigh upward toward the ceiling. Okay. Hold that as best as you can, and we'll deliver a resisted isometric test. Hold against me. If the hip joint extensor or gluteus maximus muscle was weak, we'd be able to make that assessment in this position. Again, the overpressure, end field testing, and manual muscle testing should all be performed bilaterally so that you can make a comparison between the involved and uninvolved side.